Hi, my name is Jerry Garvey. I am an HIV/AIDS advocate, have been for 30 years. Also, I was the HIV/AIDS manager for the health department for many years, and then went on to be a case manager here at Northland Cares, and I was also interim executive director for a while here at Northland Cares.
My name is Bud Sadler. I'm the clinic coordinator at Northland Cares.
My name is David Kekich. I'm a physician and the medical director here at Northland Cares.
Hi, I'm Teresa Landreth, and I am the Northland Cares Prep Navigator.
Hello, my name is Hedda Fay. I'm the Community Outreach and Program Manager for Northland Cares.
My name is Cheryl Motes de Camp, and I'm a medical case manager.
Hi, I'm James Sobo. I'm the support services case manager here with Northland Cares.
I can still remember the first person that ended up being non-detectable. After, having a pretty high viral load and not a great CD4, but and we asked Dr. Downing to run the test again because we did not believe it was happening. So and then from then on, of course, Northland Cares has like 92% of the patients they see here are undetectable.
Here lately, they came out with a campaign called U equals U. People that have an undetectable viral load, that's their HIV in their system, can't transmit HIV to another person. That's revolutionary. They didn't tell us that 10 years ago.
We have medications that work to prevent HIV either after an exposure, or people can take medications on a daily basis to prevent HIV if they know they're going to have exposure risk, which is called PrEP, for pre-exposure prophylaxis. And those medications are medications that have been around a long time, and we know a lot about them because we use them to treat HIV. And generally they're pretty easy to take. They don't have much in the way of side effects, and they're very effective at preventing HIV. So we have all the tools we need to prevent people from getting HIV, even if they have exposure risk. I think everybody needs to know their HIV status. We have great treatments for HIV that are easy to take, that don't have a lot of side effects, that'll keep people healthy and keep them from transmitting HIV to other people. So if they're, everybody needs to know their status so that they can keep themselves healthy and make sure they don't transmit HIV to other people. In the bad old days of HIV in the 1980s and the early 90s was a terrible time with HIV, and that's not the case anymore. HIV is a very easy to treat illness now. I used to work with the doc back in Baltimore. He used to say that between HIV and diabetes, he would rather have HIV. And stigma aside, because stigma is still a real issue with HIV, I totally agree with him.
Some people don't know this. Some people think that AIDS, which comes from HIV, is still a death sentence, and it's not. People can live with HIV if they're on medication and properly monitored up to 100 years. They can probably live longer than most heart patients and diabetes patients.
So we do provide HIV testing, we provide hepatitis C testing, and we're launching a self-collect at-home full panel STI test that you can do from the privacy of your own home or office. We'll be able to test you for the 3-site chlamydia, gonorrhea. We can test you for syphilis, hepatitis B, hepatitis C, HIV, and if you're found to have any of those, we'll be able to engage you with treatment at our office. I
remember one client when he came in, he was so sickly and told me he hadn't been on meds or taken somebody else's meds, and it made me cry and wanted to reach out and help him get back on his feet and feeling better physically, mentally, and just helping people feel better about themselves and feel better in general. It keeps me going, wanting to keep doing good, and also helping people that are sustainable continue to be sustainable too.
Why is housing an important part of what we do here? If people aren't housed properly, if people aren't taken care of, if they don't have food on the table, if they don't have a roof over their head, very difficult to be in compliance with medication and services. And so a person needs to live their lives with dignity and be able to be stable before they can again thrive or move forward or put together any type of goal or orientation towards their personal future. So housing is incredibly important when it comes to health and well-being.
So I'm extremely excited because we continue to grow and we're reaching so many other people that we didn't have that opportunity before. That really excites me. I know there's so many other big things that we're doing. We're going into STI testing and care, hepatitis C care, PrEP and PEP. We got all these new fantastic things, but I think just simply the fact, this idea that we're not only just reaching our small towns and our small areas, we're going to all these different places here in Arizona, and we're reaching people who didn't have all this information before. It's not even just about finding positive HIV cases anymore, but it's about teaching people these different techniques and talking about these different practices to lessen risk and to keep people from getting those new HIV positive cases.
We've grown exponentially. When I came on as executive director, we hired somebody to do a strategic plan for us, and in about a third of the way in all my thinking about which direction we really needed to go, I was reading articles on the ending the HIV epidemic, the federal plan, and I had to ask, what part are we playing in that? Not just because it's an important part of who we are, it's been the biggest part of who we are for the past 19 years, providing stellar HIV care under the founders and Dr. Kakich and Dr. Osandu and everybody here. The part that we weren't playing was prevention. And we are not a research facility, so we're not going to cure HIV. We're not going to come up with a vaccine, but we can do, a year ago, I was just looking, we had to do a much bigger part with preventing HIV and STIs than we were doing. So that's how we ramped up the outreach department. And we have an amazing outreach department that is just killing it. And we've got a lot more people know who we are, and there are a lot more people. We went from about 8 people on PrEP, which is the prevention for HIV, to about 300 now.
Wow.
So it's huge growth. In increasing our clientele and our ability to test for STIs and treat STIs, which is a big part of our strategic plan, not only testing for and caring for HIV, but testing for STI and Hep C and caring for those two as well. We have trained several staff members to be phlebotomists. We have all of the lab equipment lined up. We just don't have the space. We're trying to always remove barriers in between care and our patients. And part of those barriers is due to COVID, due to Prescott growing so quickly that a lot of times our clients can't get in to get their labs drawn on time. So we're trying to be a one-stop shop where people can come in, get behavioral health care, get their labs drawn, get treated for all the things I mentioned, and not have to go outside of us except for referrals to specialists. But we need space to do that, and we don't have it right now.
You know, when you talk about the future and where we're going as an organization, you have to think about that we're at a crossroads. We're no longer just an HIV clinic. We are now a clinic that's going to provide other kinds of health services. And so we're diversifying. And everybody says when you're investing in anything, or you're personally investing, they tell you diversify so that you can be sustainable. And that's what we're trying to do, is diversify our services so we continue to be sustainable in the future, because this is not going away. And if we do have eradication of HIV, we still have other sexually transmitted illnesses. We still have hepatitis and all kinds of other illnesses that we can expand into and be part of the health continuum for people in our community.
My hope for the future is that we can have sexual health discussions in public spaces, because I believe education and prevention equals empowerment. And I want people to be empowered and not afraid.